The year is 2025. The American healthcare system, a complex tapestry of needs and resources, is facing a new challenge. The GOP's proposed mega bill, a sweeping piece of legislation, aims to reshape the fiscal landscape. A central and controversial component of this bill is a series of deep cuts to Medicaid, the federal state program providing health insurance to millions of Americans. These proposed cuts have ignited a firestorm of debate, with major hospital groups emerging as some of the most vocal opponents. They argue that these cuts would have devastating consequences for vulnerable populations and the institutions that care for them. At the heart of the issue is the sheer scale of the proposed cuts. The GOP megabill aims to slash Medicaid spending by hundreds of billions of dollars over the next decade. These cuts, hospital groups argue, are not mere budgetary trims. They represent a fundamental shift in the relationship between the government and the health of its citizens. The potential impact is staggering, with millions of Americans at risk of losing their health insurance coverage. The proposed changes to Medicaid go far beyond simple spending reductions. The GOP megabill includes provisions that would fundamentally alter the program's structure and reach. One of the most contentious changes is the introduction of work requirements for Medicaid beneficiaries. Under this provision, able-bodied adults would be required to prove they are working or actively seeking employment to maintain their eligibility for Medicaid. The opposition to the GOP megabill's Medicaid cuts has been swift and resounding. Major hospital groups representing thousands of healthcare facilities and millions of healthcare workers have united in their condemnation of the proposed changes. These groups, including the American Hospital Association, the Federation of American Hospitals, and America's Essential Hospitals, argue that the cuts would have a devastating impact on hospitals' ability to provide care, particularly for low-income and rural communities. Chip Kahn, president and CEO of the Federation of American Hospitals, has been a vocal critic of the GOP megabill, arguing that it fails to protect Medicaid benefits and coverage. Kahn's concerns are echoed by Rick Pollack, president and CEO of the American Hospital Association, who warns that the proposed cuts won't improve Medicaid but will harm millions in the hospitals serving them. The concerns of these hospital leaders are not merely hypothetical. They are rooted in a deep understanding of the essential role Medicaid plays in the American healthcare system. Medicaid is not simply a safety net for the poor, it is a lifeline for hospitals and healthcare providers across the country. The program is the single largest payer for hospital care in the United States, covering a significant portion of the cost of treating low-income patients, the elderly, and individuals with disabilities. The GOP megabill's proposed changes to Medicaid are multifaceted and far-reaching. Beyond the headline-grabbing spending cuts, the bill includes a number of provisions that would fundamentally alter the program's structure and operation. These changes, hospital groups argue, would have a ripple effect throughout the healthcare system, with consequences that extend far beyond the immediate impact on Medicaid beneficiaries. One of the most significant changes proposed in the GOP megabill is the imposition of work requirements for Medicaid beneficiaries. This provision, long a goal of conservative lawmakers, would require able-bodied adults to demonstrate they are working or actively seeking employment to maintain their eligibility for Medicaid. Proponents of work requirements argue that they will encourage self-sufficiency and reduce dependence on government assistance. However, critics counter that these requirements are based on a flawed understanding of poverty and will ultimately harm those most in need. Another key element of the GOP megabill's approach to Medicaid is the imposition of per capita caps. Under this system, states would receive a fixed amount of funding per Medicaid enrollee, rather than the current system of open-ended federal matching funds. Supporters of per capita caps argue that they will give states greater flexibility in managing their Medicaid programs and encourage innovation in healthcare delivery. However, opponents contend that this approach will inevitably lead to cuts in benefits and services as states grapple with rising healthcare costs and stagnant federal funding. The GOP megabill's proposed changes to Medicaid represent a pivotal moment in the American healthcare debate. The outcome of this debate will have profound implications for millions of Americans, particularly the most vulnerable members of society. The stakes are high, and the potential consequences are far-reaching. The debate over Medicaid is ultimately a debate about values. It is a debate about the role of government in providing for the health and well-being of its citizens. It is a debate about the meaning of compassion, and the importance of social responsibility. The decisions made today will shape the healthcare landscape for generations to come. The GOP megabill's proposed cuts to Medicaid are not simply abstract policy changes. They are a matter of life and death for millions of Americans. For individuals with chronic illnesses, access to affordable healthcare can mean the difference between life and death. For families struggling to make ends meet, Medicaid can provide a lifeline of support, ensuring their children have access to essential healthcare services. The consequences of these cuts would be felt most acutely in low-income and rural communities where access to healthcare is already limited.